Welcome to Things My Mother Forgot to Mention.
The podcast where we say everything our mothers didn't.
I'm Jan, a trauma therapist and author turned rogue storyteller, here to talk openly about the body, aging, and all the, wait, what? Moments of womanhood.
And I'm Patti, an online business and tech nerd whose purpose is to elevate the voices of women in our world and who doesn't believe in taboo topics. Things My Mother Forgot to Mention is the podcast for every woman who's ever said, wait, why didn't anyone mention this to me?
Join Jan and Patti, two outspoken, curious, outrageous women, as they dive headfirst into a messy, magical, and often WTF realities of aging, health, and quite simply being a woman.
From rogue chin hairs and vaginal thinning
to mental health, perimenopause, and scalp cancer. Yes, really.
Nothing is off limits. It's funny, it's raw, it's real talk your mother definitely skipped.
Let's get into it.
Hi, Jan.
Hey, Patti. How's it going?
Pretty all right. How's it going with you?
I'm hanging in there.
Hanging in there? That's good.
I don't have much of a choice. I'm just hanging in there this summer.
That's fair. That's kind of what we have to do. It's hot here. How's it there?
It's beautiful. This weekend is supposed to be gorgeous, like 80 degrees dry, and then it's 60 degrees at night. And that's perfect. That's where New England does a great job when it comes closer to the fall. It's just a nice place to be.
Well, lucky you.
Lucky you.
We've been at 100 degrees or more for about a month now, and will be for the foreseeable future. So that's fun.
Yeah.
Yeah.
That electric grid, make sure it's working.
Yeah. Well, so far so good. So that's something. I mean, at least it's cold in my apartment.
There you go. At least I have air conditioning.
Yeah. But anywho,
So what are we doing today? We're talking about UTIs.
UTIs, a thrilling topic as per usual, but something that we both know people and or have firsthand experience of, and it's a very serious thing.
Yes.
And it's also extremely common. And so I thought it would be good to talk about it, because they can get out of control pretty quickly, which we'll talk about also. And also just the symptoms can be real crazy, especially depending on ages like that.
Now, it can be dangerous. I mean, speaking for the elderly people.
Yeah, so especially
Right.
for older people, because they're infections, a urinary tract infection. So it can spread and it can cause issues with your kidneys. And in this case, as you know, my uncle recently just passed from UTI that kind of got out of.
Really? Oh, I didn't know that.
He had a UTI. He went into the hospital. This was about a month ago now or so. Maybe a little more than that. He went into the hospital with a UTI. He did have pneumonia when he got in there. It turned out, but it wasn't the pneumonia that became the issue, which is also typically a really dangerous thing for older people.
Yes.
He was 82. And he didn't, within 2 weeks, he had passed. He was on hospice within 2 weeks and passed 2 days later.
Oh my gosh.
Yeah. And basically, the infection, I think he had sepsis. Maybe he didn't have sepsis. It didn't make it that far, but his kidneys were starting to not work. And so they started giving him dialysis, and he was very out of it and really having a hard time realizing where he was, and that wasn't something like on the regular basis. That was, he didn't have dementia or any sort of challenges like that at all. But he kept trying to like unhook himself, and so he had to be restrained and all of this stuff because of the UTI. UTIs can give people hallucinations and confusion, older people specifically.
Yeah, I was going to say it's older people.
Older people specifically. Yeah. And so basically his kidneys just weren't able to recover. And, my aunt had to make a really hard call. They were just like, kind of too much failure happening, and so
Oh man,
they
I
put
didn't
them on
realize it
hospice.
was from a
Yes.
UTI.
Yes. So when I say it's dangerous, I mean that because it can really escalate if you're not careful, and it can spread to a kidney infection, and that's, kidneys. So especially as you're older, and my
Yeah.
mom gets them all the time. She gets them very frequently.
Wow.
Yeah.
Yeah, because my younger years, I got them all the time. I mean,
Mm.
it would be like I would carry antibiotics with me because I was
Oh, wow.
traveling so much, and I think that the symptoms when you're younger are are like so distinctively different and so painful that I knew I had one. It wasn't
Right.
like I'd be lying around and, living my life and thinking, I wonder if I have a UTI. I mean, it
Right.
would be like running to the bathroom and being in a lot of pain and not even be able to function very well. And
Yeah.
so there's such a difference between, when you're younger having UTIs and when you're older. It's fascinating why it changes.
Yeah. Yeah, it really is. And the difference too, I know, like I said, my mom gets them very, very frequently, and she's older and, has a lot of health challenges as I've shared before. But for her symptoms, she sometimes doesn't always know that she has them. And sometimes we sometimes, like my brother and I, in interacting with her, will be like, do you have a UTI? Do you think you might have a UTI? Because
What do you think?
we'll
Yeah.
notice that she will get a little more cognitively cloudy. So she might forget a little bit more. But one of the biggest things is fatigue. She gets very,
Oh,
very tired. And so she'll start saying things like, I just couldn't get out of bed today. And I could barely, like, because she does a lot of, she has a lot of challenges with her legs. So when she does like physical therapy and does walking, she'll start saying, I was only able to walk so far without sitting down. And that for me is usually uh-oh. I think you
uh-oh.
might have a UTI. And then we ask them to check her, and sure enough, she has a UTI. But when it's gotten bad, I remember this one time. It's funny in retrospect now, just because it was such a bizarre experience. But I was sound asleep, and at like 2:30 in the morning, my phone rings, and it's my mother. And she's, living, I think it was before she was officially living at the place she's at, but she was there for rehab or something like that. And I answer the phone and she's like, hello, wide awake, like it's the middle of the day. And I'm like, what's wrong? And she's like, nothing. I just was seeing when you were coming by, to
Oh,
pick
gosh.
to pick me up. And I said, excuse me? And like she knew she was going to be there for a while. I'm like, do you know where you are? Well, yeah, I'm at the, the play, whatever. But she totally, and I'm like, do you know it's 2:30 in the morning? She's like, what? What do you mean it's 2:30 in the morning?
Mm,
And just was
interesting. Disoriented.
totally disconnected, disoriented for that, thought it was the middle of the day. And so like I called them immediately and I said, I need you to go check on my mother. She just called me wide awake thinking it was the middle of the day. And that same period of time, she started talking to a lamp, thinking that it was a person. Yeah. So it's, in retrospect, we still kind of laugh about it because what are you going to do sometimes? Like she and I will laugh about it. I'll be like, have you chatted with any lamps lately? But that's how, but she would think it was a person, or she would start to talk as if somebody was behind her. And then she'd go, well, nobody answered. So I realized. And so, but those are very, very, very common
Interesting.
signs of a
Oh my gosh.
UTI in older people.
Yeah, and older people. That's interesting. And so
Yeah.
when she does that, then what do you do? Take her to urgent care or to the hospital or a primary
No,
care or what?
at this point they just give her antibiotics. It's so standard.
Oh, oh,
Basically that's what, we contact the doctor, and again they have like whole staff and everything there. So they'll test her, she'll come up positive for a UTI, and they'll give her antibiotics, and we'll be able to tell in a few days that it's going away and getting.
what I found out was that there's over the counter tests that you can test, strips that you can
Yeah. Yeah.
pee on.
Hmm.
And also years ago, many years ago, when I used to have them a lot, that the taking the drug you had, it was a prescription drug for the burning.
Mm.
so that you could get to maybe see a doctor. It's called Peridium.
Oh,
And
okay.
and Peridium was a farm, you had to go have a prescription for it. So, but that was what people who are probably listening remember, that if you have UTI and you take Peridium, your urine turns bright orange. I mean, bright
Oh,
orange, yes.
wow.
And but it's like an analgesic. It really calms the pain so you can survive and try to
Mm.
get to a doctor. But
Yeah.
now it's over the counter.
Hmm. Oh,
It's
interesting.
amazing. Yes, it's called Azo. And Azo has a whole bunch of products that help with that until you can actually get to see your primary care, go to urgent care.
Right. Yeah. So I think that's a good point. Like, normally speaking, if you're not in a situation or a living facility that can test you and do all of that stuff,
Right,
like, yes, you need to go see somebody, pretty much urgent care, or probably
right.
urgent care, or your PCP if you can get in soon. But yeah, I mean, you and I kind of did a little research to talk about, to learn, just so that we were knowledgeable about UTIs. And the big difference, right? We're talking about, there's a difference between people who are young and people who are older.
Older, right.
And so one of the things that, and in general, women get them more than men
Yep.
typically.
Hmm.
And this,
Because the urethra
mhm,
is short and close to the anus, where you go, where you have bowel movements, and that's where bacteria gets worked up there. Right.
yeah. And that's why some women get them more frequently than other. Like, I've never had one before, but you said when
Wow.
you were younger, you used to get them all the time. So there's a good chance that your urethra is in a different place than my urethra. And that's why we get to know each
Probably.
other so well, Jan, in this
Yes, Patty. I don't
podcast.
know about this. No, kidding.
But that's what the research showed, or that when you were looking at that, was right, that it's sometimes the placement of the urethra in different women can
They
distinguish
always
why.
say for
Yeah,
women, wipe front to back.
always.
Sure, you wipe front to back,
Mhm.
and it makes a lot of sense. And
Yes.
yep.
And pee and go to the bathroom and clean yourself after having sex also,
Hmm.
because
Yep.
everything's moving around and there's lots of stuff happening.
And the other thing that I just found out, because we were looking at this, is going through menopause and estrogen, that after menopause, the declining estrogen changes the vaginal and urinary tissue and reduces what they call the good bacteria. And it can substantially make it more like a breeding ground for UTIs.
Yeah.
So
Yeah.
that means around 50, 52,
Again,
a lot of women maybe,
menopause
right. There,
giving
here
us
we are,
more
back to that
crap.
again. Yep.
Thanks, menopause.
Uh-huh.
Yeah. And it says 50 to 60% of women will experience a UTI in their lifetime, compared to only 12% of men.
I
So it's
know.
a
Isn't that
big
amazing?
difference. That's a
Yep.
big, big difference. And so when you're older, so aside from the menopause part and your hormones changing, some of it is that your bladder muscles get weaker. And
Yep.
so you can't empty your bladder fully. And
Yep.
if there's urine left behind, it allows for bacteria to grow. And so that therefore creates that. And then men, of course, they can have larger prostates, and that can be a breeding ground as well. And the other thing is that when you have lower immune systems, right, you
Yep.
can't fight and
Right.
things like that, which is why things, and talking about the good and bad bacteria, like probiotics, good, like yogurt
Yes.
that doesn't have sugar
Yes.
in it, like actually plain yogurt that you can put your own stuff in, but like things like that
Right.
are really,
Right.
really good for your good bacteria, and
Yeah.
taking care of that. And then the other thing too is drink more water. Always, I mean, pretty much water fixes
Flush that
most
kidney, those
things.
kidneys out, right?
Yeah, flush the kidneys out, drink water, because also it makes you pee more. So
Mm-hmm.
then you're flushing your bladder out too when
Yep.
you pee more. So,
Yeah, there's one last one here. As I'm looking at the list of birth control, and I never knew this. That's
hmm,
why I would have gotten UTIs. Spermicides and diaphragms are associated with an increased risk of getting recurrent UTIs. Wow. So, I mean,
mhm, yeah,
so depending on your anatomy,
yep.
your hormones, your sexual activity, your bacteria, your genetics, all of those have
Yeah.
something to do with getting UTIs, which you have never had. I still can't
I've
believe
never,
that.
yeah,
When I
I
meet
know.
people and they say, "Oh, no, I have no idea what you're talking about," because if you, I remember when I was a flight attendant and I would be flying and I would get a UTI, and there's no doctor, there's no urgent care. You're on a plane and you're trying to survive, and you're running into the bathroom and you're running, and so like I said, they didn't have prescription. You had to have a prescription for the peridium to help calm and the
Uh,
bladder. And it was so hard. I remember how painful it was, running to the
mhm.
bathroom and the burning sensation. It's hard to even focus on what people are saying to you because it hurts so much. So,
Yeah, yeah,
and that's I can't believe that when they're older, so your uncle, I mean, they don't even know they have them. It just blows my mind that it's so black and white. It's so different. Anyway.
yeah, yeah. It's very fascinating. Well, so I mean, I guess that's a good question because you've had them so much when you were younger, and then you've had some when you were older too. Have you noticed a difference in the symptoms
No.
you've experienced? So they're the
No.
same for you.
Yeah, they're the same for me. They are the same for me. And so I don't know, maybe, gosh, I don't know. That is a great question.
Yeah.
I'm not in my 80s, so
Right, right. Well, my
yeah.
mom and you're the same age as my mom, and but
Oh.
sometimes I know there's sometimes that she knows, she
Mhm.
can notice, she'll feel pain and notice that she has a UTI, and then sometimes she won't. But again, she just gets them very, very frequently.
Mm. Mm.
So, which is, yeah, it's very interesting, the different. Well, I wonder too if there's different symptoms. So, I mean, I looked up symptoms as well, especially since I don't have, I mean, I've
Right,
heard of
right.
them long enough that I
Yeah.
understand, but burning, pain when you urinate, an urge to pee that keeps coming back, and feeling like you've not peed
Yes.
enough,
Yes.
which I can only
Yeah.
manage because, like, when I have dreams, I'm sure I've learned recently that I'm not the only person that has this, which makes sense. But when you're dreaming and you have to go to the bathroom, you have to
Yep.
pee. And
Hmm.
then in your dream, you're trying to find a bathroom, or the bathroom's dirty, or their door is short, or there's some weird situation that's happening in your dream about you're unable, or like for me, I would go to the bathroom in the dream and then I'd stop and I'd be like, I still have to go to the bathroom. I just went. Like, so I
Mm.
imagine it feels like that feeling of like you go and then you're like, I still have to go.
Yep, it is. I can relate to that, and it's hard.
Yeah.
But yeah, so I'm trying to think of what other symptoms there is. It's just for me, it's just been such a shock. You just feel like you have to run, like when
Yeah.
you're driving your car, you're like thinking, I'm not going to make it to the bathroom. I'm not going to be able to get there,
Yeah.
It's
Yeah.
hard.
Well, other ones say cloud, dark, or pink colored urine from blood. So blood potentially in your
Yep.
urine. Strong or bad smell to your
Hmm.
urine. Pressure or cramping in your lower belly or pelvis.
Yep.
Wow.
Yep.
Yeah. That's pretty uncomfortable.
Yeah.
Sounds.
Just it's so interesting that I still can't believe that people don't have them,
Yeah.
that because when I've tried to say to them, have you ever had one before and try to explain, they look at you kind of like, huh?
Yeah.
Like they don't get it. So, but
Yeah. I mean, I'm grateful that
yeah,
that's
well, you see your
whatever.
mom go through that. I didn't know people can get like psychotic and dementia and get
Yeah.
foggy. I didn't even know
It's
that.
Oh my God. Yeah, it's actually pretty, like, yeah, because when I called that evening and I talked to the nurse that was on staff and I said that, and that was the first thing he said is, oh, she probably has a UTI. And so, like, for him, immediately, that was his thought of, oh, well, it sounds like she's hallucinating. She must have a UTI. And that's the go-to when you hear about somebody who's older who's hallucinating. That's the first thought that a lot of doctors and nurses have is, oh, they probably have a UTI. So
Mhm.
hallucinations are incredibly, and I wonder why that is actually. I'm gonna look that up.
So, I'm just thinking about like I said before, it was you had to have a prescription to get the something to qualm and to be an analgesic for your bladder because it's burning so much. And so now that's over the counter. You can buy it, and it's called Azo, AZO. But typically, when it's a UTI, it has to be treated with antibiotics.
Right.
And the Peridium, like I said, is also you can get it by Azo. You can get that, but it turns your urine like a bright, bright orange color, and it stains
Uh,
everything. By the way, it's like
oh
a
my
dye.
gosh.
Yeah, it stains. It'll stain everything. So
So if you get them frequently, you should have a few pairs of
I do.
special UTI underwear.
If you wear underwear.
Well, fair enough, right? Well, and that can be one of the things too, is that if you're wearing underwear, or sometimes with older people, they're wearing pull-ups or briefs or something
Right,
like that to
right,
help for leaking and stuff. Well, that's all just sort of sitting there and it can get a
right.
little wet,
Bacteria
and
starts growing.
that's a
Exactly.
breeding ground. So going commando ain't a bad thing because you get to air it all out and
Yeah,
it stays
well,
nice and
I
dry.
think
There's
that's
people that do that, you
a
know?
great thing to do.
Yeah,
You
yeah. I
know?
mean, any way that you can do that. So, but I did look up why hallucinations become common,
Oh,
and they're calling it UTI delirium. And it says it's an immune response. The body makes chemicals and stress hormones to fight the bacteria. These immune signals of inflammation travel through the blood to the brain. So it's inflammation from the infection can travel to the brain.
oh
And
my
then there's
gosh.
weakened barriers in the brain. Older brains have a more fragile brain barrier, which lets inflammation affect thinking and perception.
Hmm. Oh my.
So, common signs of UTI delirium are seeing or hearing things that are not there, sudden confusion or talking out of place, restlessness or sudden anger,
Yep.
sleep changes or extreme sleepiness. So, yeah, absolutely. It can be very scary, especially if you don't know that. And now if my mom were to call me in the middle of the night, that would be my first thought is, "Oh, okay, you probably have a UTI. Let's get you."
Yep.
But if it's serious, of course, it would be, let's go to the emergency room as soon as possible, you know.
I
Yeah.
think the danger in elderly people is that if it's left untreated, is what happened to your uncle.
Correct. Yeah, it can.
Wow.
Well, and I mean, any infection left untreated can end up with sepsis, and that's, infection in your blood.
Hmm.
So, and that's your whole body, and that's very, very dangerous if you get sepsis. So, any infection really, you need to be very careful of. I know somebody who, like I think it was a friend of my mom's who almost died from a tooth infection. She didn't realize she had a toothache, didn't realize she had an infection, and she almost died from it. So infections are extremely dangerous,
Hmm.
which is why that's one of the first things if you go, I've spent many, many, many days and hours in the emergency room with my mom over the years. And that's one of the very first things they'll always test is for an infection of some sort to see what's happening.
Yep.
And fatigue for my mom is one of the first signs of some sort of
Yeah.
infection for her, in particular. So, talking about resources
Yeah, I was just
for,
looking at them right here. In fact, when I first had a bladder infection, actually just recently, they gave me, I went to the urgent care and they gave me, I'm looking at a Keflex
mm,
because they couldn't tell the results of the bacteria because I had been using Peridium, the
to stop
and
the,
so they had to send it out to actually get cultured by a lab. So it took it. So they gave me Keflex, and then they called me 2 days later and said, "Nope, it's positive. You need this one." So then they gave me Macrobid, which is what they use, which is the common one that they give. When I was a flight attendant, they would give me always Bactrim, which is another one that they would use, and
these are all
these
antibiotics.
are all antibiotics. Yep. Then amoxicillin, of course, depending, it says on the culture result, and ciprofloxacin, Cipro,
Yeah.
is they use, but I haven't. I'm allergic to that. So,
I think my mom often gets that one. That one sounded, out of everything that you said, that sounded familiar to me.
yep, ciprofloxacin. And
Yeah.
it's interesting here in just looking at some of this information is that it says, especially after menopause, treatment can be different. A urine culture comes particularly useful because the vaginal estrogen may be significantly reduced and postmenopausal women. And
Mm.
they're just saying that when you're postmenopausal, your symptoms, whether it's your first UTI or if you've had several, it's just that it happens because of the lack of estrogen in the vagina, and you may start Patty, you may start getting them. Isn't that exciting?
I'm so excited. This is a great day.
You go through menopause and then everything starts shutting down, which is my lament about always about
Yeah,
menopause and which is the precursor to menopause, and everything starts shutting down because estrogen and the ovaries are going on strike, and it's in your vaginal area that starts
yeah,
changing. And actually one of the things they're saying that is helpful is that is using a vaginal insert,
mm,
estrogen insert that
yeah.
can help for women, of course, that don't have any cancer
Right,
in
right,
the
yes.
or history of cancer. So
Right. Yeah. And then in general, things that you can do are drink enough fluids, make sure that you
we're back
drink
to the fluids.
water, back to
Yeah.
fluids, always that. And because the main thing is it flushes your body out and it makes sure you have to use the bathroom more. And then make sure that when you go to the bathroom, you empty your bladder, that you're not trying to pee really quick or something and then like, oh, I'll finish later, which I don't know that I've ever done that, but that's what the
Yeah, that's
things
crazy. I know
say.
exactly.
And then also empty your bladder after sex. So it's
Yeah,
not just making sure you're
for
clean, but it's
sure.
making sure that your
Yep.
bladder
Yep.
has been emptied
Yep.
after
Yep.
sex. And
For
that's a
sure.
big one. And then don't hold it.
I like that, Patty. Don't hold it.
Yeah, yeah. So make sure that you go when you have to go and don't hold
And
it.
if you feel okay going commando or not wearing underwear all the time
Yeah,
or nylon underwear, maybe
right.
cotton
Yeah.
underwear would be
Cotton underwear, yeah, make sure it's really good cotton underwear that is not going to keep moisture
yep,
around your
right.
vagina. I mean, that
Yep,
really is a big
exactly.
deal. And then wipe front to back, which we were all taught,
Yep,
where most of us were
yep.
taught growing up. I think we should have been. Um, and don't douche. People believe
I know,
there's
isn't that interesting?
there's a whole thing about the culture of douching and that people. Oh, I'm having opinions, but there's this whole idea that like vaginas are dirty or bad, and so you need to douche and clean them. But it's actually not very
No,
good for you
not good.
unless a doctor is recommending you to do that for some reason, to just go out and buy douche. Like it's really not a good thing for your
I
body.
totally agree with you.
Yeah, because you get rid
You
of all
upset
of
the balance that's
you.
there, right?
Yes, 100%. And talk about getting rid of the good bacteria.
Yeah.
That's the thing, which is why often, speaking of that, why often a lot of people who take antibiotics get yeast infections. And it's because it kills all of the bacteria, and that includes the good bacteria that keeps your yeast in balance. And so that's, a really big thing. So here's just your general PSA. Your vagina is self-cleaning. I mean, let's be clear, not that you shouldn't like bathe yourself, but like you don't need any special something to be clean or, any of that. Like that's just not a necessary thing. And in fact, that can make things a lot worse for you.
Yes, it is. And it's not great taking antibiotics because I took a lot of them
Yeah.
and you only take them if you should get it tested to make sure,
Yes.
which is
Agreed.
important. And the best thing you can do, which they have now called fluconazole, which is diflucan. I don't know, you've probably never taken it. It's for yeast infections. And it's a one pill you take. It's a single dose, and it really clears things up. And
Yeah.
that's what I would always end any kind of time whenever I had taken antibiotics. So
Yeah. I'm also been very
you haven't had that. Okay, don't tell
No,
me
no,
about that.
no. I think I've had like two yeast infections or something. Like I'm just very lucky. My balance, I'm gonna get them now forever. That's my penance for,
This is going to be your penance,
yeah.
your punishment. No.
But yeah, generally speaking, I've been very lucky on that front also when I've had, I think, two ever that I can think of
Mhm.
yeast infections. And that's what I learned is, yeah, like I said, a lot of probiotics are really great for that,
Yes,
and
they are.
yogurt, things like that. And
Mhm.
but that stuff feeds on sugar. So make sure that you're not eating all the Dannon or whatever sweetened
No,
sugary,
you go
like
with no, you don't do
so much
sugary
sugar
version.
in yogurt. You
It's
get
all
plain good old
plain.
yogurt,
Yeah,
you know?
plain
It's
yogurt or
yeah,
Greek yogurt
a
that's
Greek
plain.
yogurt. Yeah,
Yeah,
that's plain. Yeah.
exactly.
Absolutely. So,
Well, I think
yeah.
we've covered it.
Yeah, I mean, and that's what I'm looking at other things. Add estrogen, sort of everything we've already said, choose your contraceptives wisely, avoid baths, which I mean, just be clean about it, I guess. Don't stew in your own juices is kind of, I think, the point there, but wear breathable underwear.
There you
Tight
go.
fabric
See,
can
I
create
knew
a
that.
moist area. Probiotics. I'm just looking at the list and it's all the things we just said. So it's like we know what we're talking about or something.
Well, through my years, I have gained some wisdom because, of course, this has always been the plague for me, the UTIs and yeast infections. So
Yeah.
anyway, oh gosh. But anyway, and for women who are just coming into this or, wondering what it is, this is a good resource. And then for women going through menopause, you may start seeing something like this start happening. So this is a good kind of
Yeah.
precursor to talk to them
Yeah.
about.
And
So,
and it's good. And I think also with everything, it's taking the shame out of it that it doesn't have anything to do with you being hygienic and
right.
it's
It has
just it's not a
nothing to do with that.
it has nothing to do with that. That can help making sure that you're taking care of yourself and everything. However, you could be nice and clean and take good care of yourself and still get these things. And so I think it's important to just, let go of any shame around that and just take care of yourself in all of the ways and drink your water.
Drink. And the end of our little lesson today is drink plenty of water and
Yeah.
make sure you go to the bathroom.
And wipe from front to back.
That's great. Well, thanks, Patty.
Thank
I'll
you.
remember all these things.
All right. Thanks.
Thanks for listening to the podcast. If you like what you've heard, please share it with friends, subscribe, and leave a review.
And remember, information shared on this podcast is not medical advice. If you have a concern about your physical or mental health, please seek support from a professional.
If you have a story you'd like to share about things your mother forgot to mention, you can apply to be a guest.
We'd also love to hear a quick 90-second thing you've learned in your life.
You can find links to both of those over at our website at
thingsmymotherforgottomention.com or in the show notes.
Thank you.